Hey, great. It looks like folks are filtering in. Wonderful, and we can get started. Hi, everyone. Welcome, and thank you so much for joining us today. If I haven't had the chance to meet you already, hi, my name is Caroline Haney. I am the Associate Director of the Career Services Office here at the Bloomberg School of Public Health. And today we are so excited to have one of our outstanding alums, John Francis, join us to talk a little bit more about specifically CV development as you're thinking about entering either maybe the federal government or international health space. We're going to get started with a fun little icebreaker. I will send it in the chat and would love to just hear from you. What is something that you're excited about this fall, whether that is related to school or something personal? We'd love to hear it. So with that, I'm going to turn it over to John.
Hi, good morning, everyone, and thanks for joining today. I know we're starting with a session that seems like something that we would have closer to the end of at least the MPH program and not at the beginning. And so it's a pleasure to be here. Just a little bit about myself. I was in the second cohort of the MPH MBA class, finishing in December of 2005. And so since then, I've tried to provide some mentorship, individual as well as group mentorship to students and recent graduates. And in that process and throughout my career, I've had the opportunity to work for the state of California, the US CDC, and then now with the World Health Organization. And through that process, I've learned just a little bit more of kind of the internal workings of how to build a resume, how to build a CV that fits more governmental type jobs that's so not the two-pager. Uh, anyway, as people are joining, and I think we see a few more people in the waiting room, it's great to see people's chats as they're coming in on things that people are looking forward to. So if you're just joining us, one of the things we're asking was, what's something that has you excited right now, whether that's in class or outside of school or other. And so I see Trek opportunities for our students at Carey. We're bringing them back. Pumpkin spice lattes. Oh yes. Cold weather. I'm sure I've heard it's been hot on the East Coast, and so I'm sure people are enjoying the cooler weather. Cool brisk mornings, new opportunities. Yep. So anyway, let's see here. Thanksgiving, football. I'm assuming it's American football, and I see go Ravens. What's your best team? Uh, that's great. It's great to see so many participants today. And Caroline, should we jump into the content, or do you want me to provide uh, any more background on myself? I see we have some rivals with the Saints, and so get some good, healthy rivalries at Hopkins. That's great.
Yeah, maybe if you want to do a quick introduction with about your
Yeah,
background, and then we could dive into the slides.
sure, sure. So I started in my public health career in the U.S. Peace Corps. And my primary focus while I was a volunteer was in tobacco. And so when I came to Hopkins, I was focused on tobacco control and policy interventions. And I had the opportunity to do the joint MPH MBA degree and really trying to look at how do I maximize resources, whether that's time, talent, or finances to maximize impact. And so within that work, I started out in tobacco control. I was able to move to from the state of California to the CDC, and then I began to expand in that skill set. Over the last 10 plus years or so, I found myself in more of a deputy role or a project management role, really trying to connect the dots between the science, the program, the policies and the people, and as well as the finances. And Anyway, so I've been with the World Health Organization for the last 4 years now, working on a malaria vaccines project. And so I'm the project manager with the malaria vaccines team. All right, should I jump into the slides and we can go from there?
I think that sounds great.
All right, great. And so we could shift from what you're excited about in the chat to if you have questions. But my hope today is to give you an overview of different ways of thinking about and preparing your resumes or CVs for governmental type work. We'll primarily be talking about US CDC, USA Jobs, as well as the WHO career site, but this really could be applied to other types of organizations. And so it would be if you think of having a short CV like a two-pager or a short resume and then a longer form CV. This is really more for the longer form CV and could be beneficial beyond government type roles. So let's just jump in with the slides that I have. So my plan for today, and I think we could go through this really quickly and then allow for a lot of conversation and discussion, is to provide an overview of USA jobs and WHO careers, discuss how you might build a CV, and I have in Word listed here because there's different platforms that you would utilize depending on where you're applying. Talk about formatting and tailoring your CV, and just give you some other considerations and point out some helpful resources, and then we can have some question and answer. Uh, and then, all right, so let's just dive right in. When, oh, but actually, what I meant to say before we dive in is this is what I've learned in my personal process. So I have never worked within an HR department. And so the information I provide, I think is just supposed to be helpful for you to consider from sort of the project side point of view. And I think what the career services provide in terms of support is also very vital. And so please make sure that you're checking with them as well as other guidance that you're finding. But the information I'm providing today is really just from my point of view. So when we look at the two major or primary platforms, did you want to say something, Caroline?
Sorry to interrupt.
Please.
Do you have slides because they're not
Oh, my
showing
goodness.
if
I should share my slides. I had the screen share and I didn't hit the last button.
okay, just
All
wanted to
right.
make sure.
So here's the session overview. And now we're going to jump in. So when we talk about, and these are the two primary examples, and you can apply it elsewhere. When we look at USA Jobs and the WHO careers site, and you look at the type of information that they request. So it's very similar, and they might have it labeled in different ways. So they'll ask for personal information or biographical and contact details. They'll ask for your availability. So when are you available, the types of work that you're looking for, contract preferences for WHO. They'll look at your demographics and citizenship for USA jobs. Uh, that is an important consideration, and we can talk specifically if you're a non-US citizen of how you might navigate that or consider US federal employment or government employment. And within WHO, they'll ask for they'll consider your eligibility. And then the biggest area and where we'll spend a lot of our time today is around work experience. And the WHO careers actually has a breakout around key achievements, but it's something that we can incorporate within both. All CVs will look at your education. Just a point, you'll notice that education always comes kind of after work experience. So after you get through your um, your education, there'll be a point where you'll probably want to put your education below your work experience. People want to see where you've been trained, what you learned, but then at the same time, they're really going to look for what have you done practically. And so just a side point there. They'll ask about trainings and certifications, publications, and this is actually one thing you'll be able to upload in WHO careers. They'll ask for your languages, your competency within verbal as well as written reading, and then the level. they'll ask for references in different ways, and you can usually put, let, please ask me before contacting them, and you can designate how you want to do that. And then they'll ask job specific questions. So you could do all of this work in advance in terms of preparing a resume. And then when you apply for specific jobs, they'll ask you specific questions that are important to how they score and do that initial review in terms of processing all the applicants that come through. And then cover letters. There's different opportunities to have cover letters. We can talk a little bit more about the value of a cover letter and how to utilize that. Moving forward, so when you're building and formatting a CV, I think it's really important to start with a Word document. You want to have one central place where you're really working to update your long form CV, because you never know when something comes along, an opportunity comes along, and someone says, "Hey, can you need to load your information into this system." And so it's helpful to have the formatting and your centralized repository of where and how you're tracking your work. Um, Within the format, and we'll get into this in a little bit more, um, there's this concept of lorem ipsum that I like to talk about. If you've ever seen someone who's developing a website or developing some sort of presentation and they don't have the content, or they're worried that the content isn't right, and that if they present the actual content that they have, that people will get more focused on wordsmithing and not look at just the formatting of how things are laid out. Um, when you develop a resume, it's important to think about how that formatting helps the reviewers uh, find the information that's relevant for them, relevant to the position you're applying for. And so what you could see here on this right-hand side is a screenshot of a research article. And what you find is it looks really nice, but when you look at it, it's all Latin. And this is lorem ipsum is a framework, or I guess there's certain words that are used as just filler. And so people just copy it, cut and paste it in here, and then they'll change it to italicized, they'll capitalize things, they'll do all caps to show you the different sections. But this gives you an idea of a nice format. And without even looking at the content, because the content's not there, you already get a sense of what people are looking for. You get a sense of the flow. And so we'll talk a little bit more about how you can create some a structure that allows people to quickly read through your CV and find what's relevant for them. And I'll go into these four bullets in just a second. Later on, I'll talk a little bit more about the Office of Personnel Management and how we think about your the grade or the level of work that you're doing and how to incorporate that within your description and your job descriptions. And then we'll talk about how to add qualitative and quantitative information, and then how you can equate your non-governmental work experience that makes it more relevant to those that are reviewing. And we'll talk about some other ways of capturing your key accomplishments and why it could be um, why it's helpful for you to update your resume and capture those key accomplishments on a regular basis. Before I move on, I just to say there's different ways of formatting this work, and where I get my guidance in terms of the formatting is from a book that Catherine Troutman wrote. And if you go to Amazon, you can find it. It's the Federal Resume Guidebook, and she has this format called the outline format. And if you've looked at CVs, there's a couple of different ways. There's the private industry that's just really top level. It's like 1 page, it's 2 page. It doesn't get into a lot of detail. And these are, you could probably draw a Venn diagram around this. Then there's the bulleted, right, where you have specific jobs and a whole bunch of bullets around the types of work that you did. And then there's sort of the block, which is more of the paragraph style, and it's just a ton of text. But the outline format tries to incorporate each of those elements and bring forward kind of a format and structure that allows for different people to review your CV and for things to come forward. I'm going to pull this up, and I just need to pause 1 second. Just give me 1 second. Okay, on this slide, what you can see is a screenshot that comes from the book that I referenced before. And within this screenshot, you actually see real words, not the Latin lorem ipsum. But what you can see here is this is a description of a specific job. So here's the job title, here's the location, here's the time in which the person was working. It just describes their whether they were full-time, part-time, salary, and that's something that you might find in the USA jobs. It's not something that you necessarily have to put in. And then you see right here is a top line description of what the job was. 1 sentence, 2 sentences. And then below is this outline that highlights the sort of buckets of work that you might have done. And what you could see here is and just to pause, when you build a resume in USA Jobs, it does not allow for you to um, enter bullets. It doesn't allow for you to italicize or underline or do anything like that. What it does allow you to do is all caps and double return. So you can create space and you can identify keywords that really resonate with the job you're applying for. So if you were to look at this very quickly, skimming through a number of different positions that an individual had, you could see whether or not these all cap words are standing out that are reflective of the type of work that they're looking for. So if I see here pay administration, problem solving, education, training, and administration, that could be great. But if you're hiring someone for a finance job or you're looking for someone who has clinical research experience, someone could easily see this person doesn't fit my profile. And as you're applying and as you're developing a CV, what's important is that one, you put what's accurate to what you've done, but that you might want to think about how you might substitute or rebucket your work to more align to the specific position you're looking for. So anyway, I think I've covered this here. So thinking about having sentences versus paragraphs, using keywords, using all caps, and the use of space. Just a note with WHO's career site, you can't create spaces except in your cover letter. And so those all cap words are really important for you to bring out when you enter that into the WHO career site. So I'm going to use this. This is more specific uh, to U.S. federal employment, but I think there's some application beyond the beyond just U.S. federal employment. When when you see a position come out from the U.S. government, there you'll see that each position has a title. It has um, a job series. It has a number associated that's the series, and then it has a grade. And so what you might see is a 601 epidemiologist, GS, that's the general service 12. And that coding tells a lot about the type of position. And across the US federal government, it's the Office of Personnel Management that has it's the Office of Personnel Management that establishes each of the job series as well as the grades. And so when you apply for a position, you might actually meet all of the criteria of the job description, but it's also going to be important for you to demonstrate that you also meet the grade, meaning the level of complexity of the work that's required, as well as the core criteria for the job. I'll give you an example. There's a job series that's around health education. And that job series requires you to have master's level education as a criteria. And so if you were applying, even if you've done that work in another capacity, you would not be considered uh, e- for the position because you don't match the job series criteria. And so when you see a job being posted on USA Jobs, it's important to go back and look at the OPM classification and look for some key words and try to say, how can I make sure that I demonstrate the work that I've done and how that translates to the job that's there. I'll give you an example. Within, it's called the 685 series. There are two kind of primary areas. One is a public health analyst, and the other is a public health advisor. And I was in a public health analyst role, and I was applying for a public health analyst position, but but it was the same grade. It was very similar in terms of description. But when I went to apply, HR looked at my resume and they saw that I had not ever done any advising. But I went back and I looked at my CV and I had language like provide guidance to national partners, states, and other public health organizations with the implementation of evidence-based, guidelines. And so I was using the word guidance versus advising. And when I changed my resume, I was able to get through those initial checkpoints. So one thing to point out, if you were to look up the 601 series, which I think a lot of you are probably looking for, that would be the epidemiologist, the public health scientist role. It's very top level. There's not a lot of information. If you were to do the same for the 685 series, it's the public health analyst, the advisor, if you're more into the programmatic aspects of public health and public health program and implementation, you'd be interested in that series. There is this document that they've created for the 685 series, and I'm going to pull it up real quick, um, just to give you an example of of this document. You'll find, and this is this specific link. It's pretty remarkable, and let me see if I can zoom in real quick. And in the background, if you want to look up 601 and 685, you'll probably see that's very, very light. But there's this PDF. And I would encourage you, whether you're an epidemiologist or other, to look here because this document goes into great detail about what's required, the type of work, as well as the level of experience. And so if you were to go through this document, and even if you're not interested in being a public health advisor or an analyst, you'll find some key words that you want to bring forward in your resume. So when you look at the 13 level, what you're finding is difficult, responsible assignments. You're looking at state and local settings. You're looking at, um, anyway, so you would look through here and you would start to see that there's key words that not only describe the what, but at what level, as well as the frequency, as well as the level of autonomy. And so when you start adding in descriptions of the work that you've done, you really want to demonstrate that you've been doing that work at least for a year at that level, if not above. And so just something to think about. This is a great resource. I continue to go back and look at that in terms of trying to describe my work and help it translate. And again, this is not just useful for US federal employment, but can be applied to any resume you have. So I would go back and look at this as a great way to find keywords to describe your work. And I'll go a little bit more into that in a minute. So uh, to further, actually, I'm going to go into that right now. When you're illustrating your CV, it's important to provide both qualitative and quantitative information. You could have worked on one grant that was $10 million, or you could have worked on 20 grants that were $100,000. By providing that information, it will show and demonstrate not only the level of work, but also the complexity of the work. And so those are quantitative ways, but qualitative also shows kind of in what environment are you working in. What are the contexts? Is there limited staffing or other challenges outside of the work? And one of the ways I describe this is if you're familiar with umami, there are five tastes, and there's bitter, there's sour, there's salty, and sweet. But they discovered that there was a fifth taste. It's umami. It's this texture. And so when you're going through and looking at your resume or reviewing someone else's resume, what you want to look for is, you might get a sense of like what they've done, but you want some more context. You want some of that umami that really gives some texture to the type of work, the frequency, the intensity, the level of experience, as well as the value that you brought. And so just as you're putting your information in, and you don't have to have numbers for everything, you don't have to have qualifiers for everything, but it is helpful to at least provide some level of quantification, especially around the key areas of focus for the job that you're applying for, so you could see and help them translate whatever you're doing. Equating non-governmental work. When I was applying uh, after working at the state level for federal employment, and while I was within the federal government, it was sometimes difficult for HR to see where the previous work I had done translated to the federal government. And so oftentimes I would say something like, as a health program specialist one at the state of California, and in parentheses, I would write equivalent to a 685.13, and I would really make it clear of what I was doing. And then within the description, I would provide key examples, key words, quantification, qualification around the fact that I was doing that work at that level. So anyway, there's ways that you can bring that in, but you really want to make it very clear that not only have you done that work, but you've done it at that level for a considerable amount of time. The last thing to think about, and this is mainly for key achievements, is they call it the STAR method. So whenever you try to highlight a specific example of an accomplishment that you had or a challenge that was overcome, the STAR method is really helpful. And you can really boil it down into 2 or 3 sentences where you just make sure you describe the situation, the task, what you did, and what the outcome is. So if you could think of, in the context of COVID, all of our personnel were working on COVID response. I was tasked with maintaining our day-to-day activities, right? So it might have been the same work, but you had no additional resources within your team. And then what was the work that you did? What did you overcome? Another situation could be, you know, in the context of declining resources or available resources. And then you describe the task. And so when you start providing that information, it helps people understand the work that you've done. And just as an aside, if this is more about performance management, it's really helpful for you on a semi-annual basis to really document the key things that you've achieved and keep that to yourself, or keep that on your own file, because you never know when 15, 20 years down the road you end up back with the same type of job or a similar um, type of work that might be at a higher level, where you really want to go back and say what was I able to accomplish there. And so it's helpful, one, to capture in your CV the key accomplishments in your work, but also to refresh yourself as you're interviewing for a job, or as you're trying to translate what you've done to a specific job that you're applying for, and remember and be able to pull both the quantitative and qualitative elements of the work that you've done. So those are some ways to think about how you illustrate your work within your CV. So just some considerations. One of the reasons why we're having this call now is there is a process within the US federal government around the Presidential Management Fellow, or the PMF. And I think they open their application sometime in September, and I think it closes in October. And it seems super early for you, where you are, to be thinking about applying for jobs. And actually the CV submission process for the PMF doesn't require USA jobs. But if you were to build your CV in Word, I think this would be a great format for you to communicate in like your value and what you've done to date. The other thing to think about is it's really important to start early and update periodically. When I go back and look at my CV, I always capture things I've missed or might have spelled wrong, or I want to clarify or could be construed differently. And so it's helpful for you to think, hey, maybe once a month I'm going to work on updating my CV so that when I get to the point of applying for jobs, I can I can really have something crisp that I'm ready to go with. The other point is you never know when someone's going to say, hey, this position's coming forward, put your name in the hat, but it's, a week before it closes. And then you have to pull everything together at the last minute. Related to that, when you build your CV in USA Jobs or within WHO careers or some other space, there's often a search element that you can get notified when jobs that match your level of experience, where you're willing to work, the type of work you're looking for, keywords come up, you're notified. So as jobs come forward, you can really start to get a sense of what's coming forward and you don't miss opportunities. And then you don't also have to worry about going back and searching on a weekly basis for anything new that's changed. So we talked a little bit um, uh, about the cover letter, but just to go into a little more detail, that different people, and I'm sure the career services can give you some good advice on how to use your cover letter. Some people review the cover letter within their review and weighting and scoring of an application. Some people don't, but the cover letter can really help bring forward what you think is important in your CV. And so when you develop a cover letter, it's really important to make sure that you tailor it specifically to the job and that you highlight the key things that make you not only qualified, but to be a successful candidate. And so if there's things that don't translate well within your CV, it would be important to make sure that that's captured here. It's critical to keep that really crisp and high level, but you still need to make sure that you're bringing in that umami, that quantitative, that qualitative elements that help some translate for someone why you're a good fit and would be a successful candidate in that role. We talked about recording and tracking your performance over time. I think that's just great practice for you. You never know when you achieve something and someone says, "Hey, I want to put you up for this award." Could you write up a draft award, presentation, or someone says, "Hey, can you give me an example of something you've done?" You can easily pull from that then versus having to go back and look through your emails and try to remember what was done as well as like what were the contextual factors. Um, you'll often hear people say that there's like that black box, like you apply for something and nothing comes back. I will say, depending on where you are in your career and how long you've been in the space of public health, it's not uncommon for individuals to never hear anything until later in their career, when they're applying to federal level or intergovernmental or global type positions. And oftentimes you'll see people come up through the ranks. And so that doesn't mean within the organization. That could be you worked for a consultant firm that worked with the CDC or with WHO or some other large entity. And through that process, you got to know people internally and you got a sense of the internal culture and you're able to demonstrate your value. It could also be um, that that people are looking for someone to go from, the local level to the state level to the federal level. That that can take time, and it's okay if you don't hear anything back. But it really is important for you to have, if you think that you would want to work at a federal level or a governmental level, to have something prepared and something that you're applying for. And it's just a great process when you do get you through the next stages in your application, just to practice interviewing, updating your CV, and being ready for when the right opportunity comes. Automating searches, I talked about that a little bit. Play around with it. It's different between each of the sites. So you'll want to make sure that you're working to tailor that. And there's oftentimes periods where the automated searches will turn off. And so you want to go back periodically and refresh those searches and make sure that they fit your needs. In this slide deck, and I'll provide this to Caroline and we can share this afterwards, I provided some links. So USA Jobs, there's this how to build a USA Jobs resume. There's the PMF program and application timeline. If you're interested in that, I'd encourage you to, use this as your starting point if you want to apply, because it would be possibly this coming summer that process would be finalized and that PMFs would be selected. So it's something to actually start thinking about now. Then there's the WHO careers site. These are the 3 links to the OPM series within the US federal government. Here's the 685 document. That's the PDF that has a really good descriptive language on the level and complexity of work that's required. And then the last one is the key document that I think is helpful, this federal resume writing guidebook. It's something that you could purchase, or something you could just look at a few of the pages, but it'll give you a sense of that structure that we were talking about earlier. All right, I have talked a lot, and I'm looking forward to hearing from you. So Caroline, let me turn it over to you and we can figure out the best way to address questions and move forward.
Sure. So we've had a few questions that have come through the chat already. So I'm happy to read those out. There were a couple asking about the slides and resources. So it sounds like you'll send that after the fact. I'm happy to email that out to attendees. Um, let's see if I can go back to the first question. So the first question that came through was, can a resume reviewer make the connection between provides guidance and advises? So I think you were talking about kind of word choice in that moment.
Right. And I'm sorry, I realized my screen might have been off for a while. My apologies. So yeah, one might assume that someone reviewing your resume should be able to do that, but that's not always the case. And HR is really good with HR, but they don't understand the specifics of a job and necessarily as well as the technical unit or the hiring manager or whoever's responsible for the final selection. And so that's just a good example of where something could be lost in translation with those initial hurdles. I don't know what sorts of AI will be applied in the future to different applications, but it's easy to assume that there'll likely be additional screenings that will really try to prioritize where both HR and the technical units focus when they're reviewing. So it's important for you to kind of understand what are the key things that they're looking for, so you're not getting kicked out too early in that process. So that's just a good example. But yeah, it would be nice if someone could say, hey, guidance, advising, those seem fairly similar.
Yeah, I think that's a good point. I definitely think that, I mean, we've already seen AI being used in scanning resumes, but I think that that's only going to continue to progress. So another question, I'm assuming this doesn't apply to federal government jobs because you can upload a CV, but in situations where an organization is requiring you to fill out a form as opposed to allowing you to upload a CV. The question is, how should you prioritize and select what to include given that there's limited space on the application form?
That's a great question. And so the WHO career site is exactly like that. It's form based, and they often have either drop down or like specific things that you can select for answers, or kind of open space for text, and then they'll give you a text limitation. And so what I would say, how do you prioritize that? You really do want to think about what are the key things related to that job. And this is why it's important to have a Word document for your CV. And so what you might have is if you use that, I'm going to come back to, if okay, if you use this outline format, what you might find if you're applying for a specific type of job is that there might be two or three key things that you want to highlight, even though your longer form CV has more information. And so what I would say is you want those keywords there, and you want to be able to truly quantify and qualify how that specific job meets the criteria within the position you had. Within, as you're filling out those forms, I've never seen it where it says you can only list 3 jobs, right? So you should be able to still put in your full career, but yes, it might be limited in the information. So I think what you want to do is just make sure it aligns with the job itself as well as the type of job. So if it's an epidemiologist, you want to make sure that you're qualifying your level of education, adding your publications, et cetera.
Great, thank you. So the next question, I think this is a really good one, is do you have any advice on how to highlight or position your educational experiences at Hopkins? So coursework, um, leadership or student involvement, things that you might partake in here at the School of Public Health.
That's great. One, I can't encourage it enough, and I think this, probably all of you are actively engaged in one of the different societies or working doing some research projects, and then you're probably in 3 or 4 different project teams with one in each of your courses, and you'll end up producing something that's valuable. I just went through an internship selection process, and there were a lot of students that highlighted that they had worked on malaria vaccines, which is the work that I was in, and they had worked on it in a class. And so there's different ways of including that. We talked a little bit about um, trainings and certifications. And so you might list within your education, just the top level education you have, but maybe within the trainings and certifications, you could list something that's specifically relevant to the job that you're applying for. Um, you might, within publications, have, list a report that you developed that while it wasn't published, or maybe even a poster that you had for um, a conference or something like that. So there are different ways to put that in. If you're having trouble, the last idea I have is if you do, whether it's volunteer or paid as like a research assistant, that would be another place where you could, even if you didn't, if you were doing the work within a course, to maybe highlight a specific thing that you've been applying. So I think there's a number of ways. But if you're not sure after that, or in addition, I would make sure that the cover letter highlights that specificity, not necessarily I took this course in epidemiology or biostatistics or applied policy. You'd want to say like what was the product that you developed, even if it was just for a grade. That would be a good way of demonstrating that you've worked through the types of questions or the types of work that you're applying for.
So the next question is there a limit on how long the government's CV should be? Is it better to provide more detail or to try and keep it concise?
The, I think if you're early in your career, it's helpful to have it concise. But as you go longer, I mean, you want to make sure everything's documented. And so this is why that the use of the block or the outline form and the keywords is really helpful. If you think that someone's looking through 300 CVs and they're maybe spending 1, 2 minutes just saying, is this person worth reviewing or not? You want to make sure that it's very easy for them to review. And so how you structure your CV will be important. And so even if it's 20, 30 pages, and actually, if you look at WHO careers, when you start putting in all the trainings, it could be really long. Um, but after you've reviewed a few CVs, you'll find uh, on the opposite end, on the reviewing end, people develop a process in which they're looking for either keywords or they're looking for formatting, they're looking for concrete examples. And so if you can make it easier for the reviewer to find how your work aligns with the work that they're looking for, it doesn't really matter how long it is. It's really about how structured it is.
So another good question asking about the referral process for WHO. Is there a referral system, and is that something they should try and pursue?
Is this the public health recruiters one, or
No, it
okay.
actually says do referrals work when applying for a job in WHO. So I think
Yeah,
if I'm interpreting this question correctly, it's, should they be looking to obtain a referral when they are applying to WHO or
I
before applying?
yeah, so anytime I've seen a position, if I can get more information about it or I know someone who knows the job, it is helpful to get a sense of, what are they looking for? That you'll often see positions posted and they're really just trying to fill the position with the person who's currently doing the position, but they're not actually in that box. And so, when you find out, hey, this is really lined up for somebody else, it is helpful to do some networking in the background. Um, I I have had people, it's not uncommon for people to do that networking, and it is helpful for someone to say, "Hey, keep your eye out for this person." And I'll tell you the truth. When I've reviewed CVs, I've known that certain people are applying, and they've actually had very poor formatting, and it really took me a lot of work to find how their work translated to the position. Um, but in the formatting, it also told me something. So yes, I think it's helpful to do your own networking, um, but it doesn't guarantee that you're going to get through that process. And with, you know, I, I'll have a recruitment and we'll have 300, 400 applicants. And so HR might screen through a lot of them, and I might not even see those individuals. And I've had that before where someone said, "Hey, I applied." I I didn't see it. And so things get filtered out at different points. And that's why it is important to make sure that you're accurately presenting your information in a way that's helpful for all the parties that will be reviewing.
Okay, next question. Is there a preference between a resume versus a CV when it comes to the hiring processes at WHO and CDC, or I guess more broadly, the federal government?
So confession, I always get CV and resume confused. So I think I would consider it like a short form resume, like in a longer form CV. And so when you look at the structures that an organization such as CDC has, or like USA Jobs or WHO Careers, there's a structure that they're looking for, and that really aligns more with what I understand a CV to be. So you've got to be able to build something in Word that you can copy and paste into the different systems based on their
Mhm.
requirements. And I'll give you an example. So WHO, they have a specific field per job you've had that lists key accomplishments. So that's broken out from like your description of work, where at CDC it goes description of work. There's nothing about key accomplishments. So you want to make sure that you copy and paste that into that other field. I don't know if I'm answering it right, but I would say it would be helpful for you to have two Google Docs, one that's a short form resume and one that's a longer form CV that sort of matches this, that you could easily tailor as you become aware of jobs. Second is it's helpful for you to build a profile so that you can be aware and ready should positions open up.
I'll just add that I think differentiating between a resume and a CV actually varies when you're talking about employment in the United States versus elsewhere. So I've noticed that much of the world uses CV and resume interchangeably. In the United States, we think about CV as being a way for you to highlight your academic endeavors, and it's usually used for academic based or clinical based positions, where a resume, short or long form, would be used for positions outside of that. So I think that adds
Mhm.
like another layer of, complexity to it.
So can I come, there's the question about AI scanning and plagiarism. Can I help take that one on? Just
Of course.
so I've seen applicants that will literally cut and paste the job description and then just put in the cover letter and other things like I've done this. And they just it's clear that they've pulled the language from the job description. Um, it doesn't tell me anything about that individual. So what I always find helpful is whether you print it or have like a PDF, like a electronic, you want to highlight the keywords and then where it's appropriate and aligns with what you've done, you want to make sure that those words are there. But if you have a standing form CV or in resume, there shouldn't be an issue of plagiarism. And but I think what happens within the AI scanning and things like that is you'll be asked key questions about the specific job. And I'll give you an example. One time I was applying for something and it says, "Do you have training or a certification in X?" And I didn't, but I found a free online training. I did it and then I hit send, right? And so I was able to say like, yes, I've done it because I knew that when they start filtering, they would say, let's only look at the people who have this training and certification, right? And so you want to be able to tell the truth and you want to use your own words, but you do want to identify the key words that they're going to be looking for as they're reviewing, as well as the key criteria for the position.
Great. So I know we have a few minutes left. John, I know we're not going to get to every question today. I don't know if you wanted to scan through and see if there were one or two more questions that you wanted to address.
Feel free to do that. I've got a few more minutes if other people do as well. I don't, so if we want to go a little bit longer, I'm okay with that as well.
Okay. I think there was one I actually missed. I'm going to go back to, which is, um, are there organizations that work with public health recruiters who could review a CV and recommend jobs in specific public health slash governmental sectors?
So I think there are, I've heard of this. I've never pursued that, so I'm not sure how useful they are. I know I've known people outside of public health that were former military who would pay someone to help build their USA jobs resume, and they would end up with something really crisp that was accurate. And so I think that does happen. But um, I don't know how much it helps. And in terms of recruiters, I don't know. I think that might be more in terms of working for some of the big consultant firms and things like that. But I so I don't really know. I do think there are people out there that help, but I have never seen specifically how they've been helpful for mapping public health careers.
Going to get to a question that was kind of upvoted a number of times. So for non-US citizens slash international students, are these job opportunities available to us? Is there something more we could do or highlight to increase our chances of getting hired?
Yeah, so just to say it is difficult within the US government to be a non-US citizen. That the deck is sort of stacked against you. There, when you look at, and I didn't get into this, there are Title V positions, which it's a section in the US government code that allows pe for people to be employed. But there's also a Title 42. And Title 42 is specific for kind of research and scientists and things like that. Um, and so I have non-US citizen friends who are Title 42 employees. And CDC is a global has a global presence, and they have a lot of people hired under Title 42, but it doesn't go through the USA Jobs process. And so, yes, there are ways to get jobs, but you'd have to really strengthen your networking and really try to find your way in through working from a Ministry of Health or through another organization. There are also other groups like ORISE, it's the Oak Ridge Research Facility, something like that, um, that is used as a mechanism to bring on fellows, as well as looking at other um, kind of government contractors. And so I would look at those as opportunities to get your foot in the door. But and the last thing is Schedule A. If the U.S. government has a policy that helps prioritize the hiring of individuals with disabilities, all sorts of disabilities, and so if you qualify for Schedule A, you can get on this list and you can apply for jobs non-competitively. The challenge, again, similar to ORISE and similar to Title 42, is you really need to do your own networking in the background, right?
Mm.
Like if you're focused on, let's see, injury prevention and uh, gun violence, right? You'd want to be networking with that group at CDC or a different organization so that they know that you're about to graduate. They know the kind of background that you have. And they might be aware of, oh, this person's a non-US citizen, but they're really going to add value. So there's some additional networking that you really want to bring forward in your searching.
Great. So I think one of the last questions we'll get to today is, does WHO and USA Jobs have a general application in addition to applying for specific positions? Something where I guess you could just sort of upload your CV or resume to be considered for positions. And if so, how often should that be updated?
Yeah, so in USA Jobs, what I'd recommend first is build a Word document for your CV. Look at CDC, you look at USA Jobs, look at WHO Careers, build a Word document that could translate to both. And then I think what you want to do is you want to put your information in there so that you're ready to go. Um, but that becomes your template, and you can create multiple versions of your resume. And this is where it can get confusing, right? You might change your core resume, but you've already modified for that specific job, or you modified for that specific job, but you want to bring that back to your core resume. This is where the Word document comes in very and helpful and handy. So yes, I think it's a good practice to just have something there, but just think about version control. The other thing to say is there are groups, so like State of California, they have job series and you get on a list. And so you literally apply to be eligible to demonstrate that you're eligible for a job series. It doesn't mean that you're going to get a job, or you might apply in WHO to get on a roster as a consultant, but it doesn't mean that you have a job. So look at those opportunities. Those are great ways. But also it's good to be aware if you know you want to work in a specific area or a specific group to um, to go through that process so that you've cleared those initial requirements. When the job comes, then you can truly apply for it.
Great. So wrapping up, I've seen a couple of folks comment. We are recording this presentation. I'm happy to send this out after the fact if you'd like to revisit some of John's recommendations or for folks that were not able to attend today. And I will also send out in that the slides and resources once John shares them. So did just want to say thank you to John for taking the time. You're what, 6 hours ahead of us right now? Is that
I
right?
am.
So we very much appreciate you taking the time after a long work day to speak with all of us and to share your knowledge. And thank you all for attending. If you have any follow-up questions, you're welcome to reach out to me directly. John, was there anything else that you wanted to add?
Just to say, yeah, I would encourage you to work with career services. And then Caroline, if there's specific individuals that would benefit from additional review, I'm happy to make myself available. I think um, I I'm not as responsive as I used to be. I want to be helpful, so that's why we created this session. So please work with career services. The other thing I wanted to say is if you're in the MPH program, it might feel early in the program, and then you're also worried about like, will I have a job in May? Like, do I have a job? And you're defining kind of success based on that. I just want to give you encouragement to give yourself a break, give yourself time to be present. You're exactly where you need to be in your career. It's great that you're here. It's great that you're thinking about your CV and how you look for jobs. And I think it is an important thing, but just try to maybe set some process goals. So, do you want to look at your CV once a month between now and May and really tee some things up, whether that's within government or non-government? And don't put a lot of pressure on getting it right the first time. So anyway, I just want to encourage you exactly where you are to be present in your program, to know that you're exactly where you need to be. And I'm happy to be helpful. And if we want to set up a follow-up call later this year, just to check in, that might be another thing that we could do. But thank you.
Excellent. Yeah, thank you. And those are fantastic parting words. I think that's what we try and communicate to the students, but it's always helpful to hear from somebody who has lived experience, who has done it themselves. So thank you, John. Thank you, everyone. Very much appreciate you attending today. And we hope everyone has a great rest of their afternoon. Bye bye.
All right, thanks all.